If I had to give parents 3 tips to think about before they go back to school, number 1 would be to make sure your child's exam has been up to date. So be sure to see someone if it's been more than a year. That's a great chance to make sure your immunizations are up to date. The second thing would be to make sure that we've had an eye exam if the patient has been having any concerns. You hate to start back at school if we're having trouble seeing the board or reading our books. And then third, I would want to make sure our parents are really looking at getting back on a good routine in terms of sleeping and screen time. I would recommend a back-to-school physical for a child who it's been over a year since they were last seen by their physician, particularly if they're going to be participating in sports or other physical activities. The reason why getting a sports physical is so important is so that we can ask the right types of family history questions regarding things like heart disease or unexpected deaths from a heart attack or things of that nature. We can also ask about the type of sport, maybe what position they're playing in, and past injuries, and this may help us decide if further testing needs to be done in terms of cardiac testing, or if we want to encourage our patients to have a baseline concussion test because they're at risk for having an injury during their school year. For our kindergarten, our children that are 4 to 5 years of age, we're often thinking about making sure they're up to date on their measles, mumps, and rubella, MMR vaccine, and the chickenpox vaccine. We'll affectionately call the 7th grade shot the tetanus booster, so that's something to think about for those children in that age range as well. For college students, we're going to want to make sure they're up to date on all their childhood vaccines, obviously, but also make sure that they're up to date with meningitis boosters if they're due for that. Definitely want to talk about HPV if that hasn't been done already. Depending on the time of year, definitely want to consider flu vaccines as well. We do recommend our college students make sure they're up to date, if not get their first booster for meningitis. Meningitis is an infection that typically occurs in young children or adolescents, and we tend to see it in places where people are living in close quarters, so say in a college dorm. It can be a very serious infection. It can even lead to death in the most severe cases, so we want to make sure our college students are protected. Meningitis can come in different forms, so when we vaccinate, we're really protecting against bacterial meningitis, certain forms of that. You can also have viral meningitis as well, and in general, these will present with fever, neck pain, severe headache. In those cases, when you're having severe symptoms, you should seek treatment. The HPV vaccine stands for human papillomavirus, and it's a vaccine that helps protect against the most high-risk strains of this virus. We typically think about it mostly in the setting of cervical cancer for our women, but we see a lot of HPV-related head and neck cancers, other types of genital cancers as well. So we do recommend it for both our young boys and our young girls. Parents are often concerned when we bring this up because they feel that it's early to talk about this type of vaccine. One thing to keep in mind is that it actually works better the earlier that we give it. There are 2 different versions at this point. One is a 2 vaccine series and one is a 3 vaccine series. The 2 vaccine series we can give up to age 15 because they're younger. If we end up giving the vaccine later, we have to give a 3rd dose because the immune system responds differently. The patients that really should consider baseline concussion testing are those who are at high risk for concussions, and those would be our younger kids who are playing contact sports. Sports or activities that we feel are higher risk are not just things like football. It can be activities like cheerleading, where maybe the patient's being thrown up into the air for an aerial trick. It can be things like soccer, where you might have the risk of running into someone and injuring your head as well.